Yes, we are live. We are live. We are live. Good evening. And how are you? Welcome, welcome, welcome. Where are you joining me from? Yes, yes, yes. How are you and welcome? Where are you joining me from? So if you can hear me, tell me where you're joining me from. I see someone already online. Who do we have here? Good evening, good evening, good evening. Yeah, we have some people already joining us. We have people joining us. Welcome. Good evening. Good evening. Hey, Jessica is here. Yes, good evening, Jessica Uloma. How are you? Oh, yeah, everybody. Jessica from Canada. Tell me, where are you joining me from? So we are talking tonight on something very, 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 very interesting. So invite your friends. Tell them to come listen tonight. Our guest is already on ground. He's waiting for you. So the time is 8 p.m. on the dot. You are welcome to ask the doctors. This is a program that's been going on for the past 2 years, and we talk about health every Sunday by 8 p.m. Nigerian time. I'm not alone. I have some co-hosts that joins me on the program. My name is Dr. Frederick Unubohai. I always tell you good life in a sense. I have Dr. Israel Irobonose. I have Dr. Blessing Arimie as co-host of this program. Tonight, we are talking about female genital mutilation. And we have a guest. Our guest is already on ground, so I'll be bringing him up very, very soon. So tell me, everybody, where are you joining me from? This is a very interesting topic. Get your pen and paper. If you know anyone that has been mutilated before in the past, or you were affected, or you feel that this act should continue, you have opportunity to drop all your comments and ask your questions here tonight. So let me bring up our guest on the program this evening. Welcome. I see you. Facebook user, I see you, Ezekiel. I see you, Peace. Yes, good evening. I see you, Belly Love Gold. I see you, Princess. I see you all. You are welcome. Good evening, sir. Hello, Chief. Good evening, sir. We can't hear you.
Oh, good evening, Fred.
Yes, now I
Yes,
can hear you loud and clear. How are you doing, sir?
I'm fine. Yeah, and you?
I'm doing very, very, very well.
Yeah, it's great to be here again.
Thank you so much, sir. I know what it means for you to be here with us tonight. Some people might not really understand. We appreciate your time, Chief. Thank you so much. Good evening,
Yeah,
everybody. So we have joining us tonight, we have Dr. Qudus Lawal. He's a specialist, a gynecologist, an obstetrician. And there is no person, no other doctor that is fit to talk about this topic than Dr. Qudus Lawal tonight. And it's a great honor to have him on this program again. He has been here, I think this is like your third session or your fourth, Chief.
yeah,
Yeah, I think so. Yeah. Um, Now, commonly in our environment, people believe that female should be circumcised. That word is called circumcision, which has been abused in the medical world, like you know, Chief. It's illegal, it's barbaric. So let's start briefly for those of us that are listening, Chief. What exactly is female genital mutilation?
yeah. Thank you very much, Fred. First of all, it's good to lay a foundation on what female genital mutilation is all about.
Okay.
Just like the male counterpart, the woman also has what we call female genitalia, which is in layman term we call our private parts. Now, there have been some procedures, some interventions that have been done on the female private part over the years, which we not term as mutilation because it's of no medical benefits to the
No benefits.
young girl. Yeah. So that's what female genital mutilation is. A lot different words have been used to describe this. Some have called it female genital circumcision. Why I will not succumb to calling it female genital circumcision is that it's one is trying to make it look like male circumcision, which is not exactly the same. Uh, Others have called it female genital cutting, but I think female genital mutilation best describe what is done. And by definition, female genital mutilation refers to any all procedures, be it partial or total cutting of the female genitalia or any procedure done on the female genitalia for non-medical purpose. Now, you said partial or total. So any form of cutting that is done on the female genitalia, when we say female genitalia, we are referring to that area we call female private parts. So any cutting that is done there, be it partial, meaning that maybe you just do a little scraping on it, or total, which may refer to totally removing some part of the female genitalia. That's what we refer to as female genital mutilation. Or sometimes it doesn't necessarily need to do with cutting. Sometimes some substances are inserted into the genitalia, that is into the female private parts. Sometimes piercings are done, some cuttings are done, which may not necessarily involve removing. All form of procedure carried out for non-medical purpose is what we refer to as female genital mutilation.
Okay, thank you very much, sir. Uh, if I may ask, let's go back in time in history. Why was this really done? What was the whole essence of trying to circumcise a woman? Because I know that it's still being done in this present day generation, and some people still believe that they have cogent reasons for carrying out this act. What were the reasons, and do they have any basis at all for carrying out this act?
Yeah, thank you. This practice of female genital mutilation dates back to very, very long time ago, over 2,000 years ago. Female genital cutting has been carried out in different form by different group of people, and different reasons have been ascribed to reason why this procedure is done. Uh, One that comes out striking is that they want to maintain chastity of a young girl by mutilating the girl child. They feel that the girl will be remain virgin throughout her life until during marriage. But that is, of course, that definitely is not true. It's not something it's something that has been shown not to be true. Rather, it makes the girl child less receptive in terms of sexual interaction later in life when she gets married, and usually leads to problem in marriage. Another reason why they've ascribed to reason why they do female genital mutilation is that they feel it makes the genital more aesthetic, looks more nice, so to say. Again, this is not true. The natural way God has made it is the best way it should be. Now, we also talk about they also talk about the fact that it makes them more um, um, what's the word now? It makes them more of higher ranking in the society, that ladies that are circumcised, ladies that have the female genital cutting are higher in rank compared to those that are not circumcised. They are the ones that can actually inherit in the society. So a lot of sociocultural reasons have been given. Of course, there are some religious thinking too. But again, these have not been substantiated as there is no uniform agreement on its role in religion. By and large, the reasons that have been given are not something substantiated. And as we go on in the conversation, we see how this procedure negatively affects the girl child or the young lady.
Thank you very, very much, Chief. Dr. Israel is in the house. Dr. Israel, how you doing? Good evening. Welcome, everybody. Now, Chief, quickly, I want to ask, sir, in your practice over the years, with what you have seen, do you think this is something that we really need to address? What is the burden like? You know, when we're talking about this, people just feel it's something out of space and they're just talking because they want to talk. But in your practice, with what you have seen, do you think we really need to talk about it? And in what area should we spread this information, sir?
Yeah, thank you very much. I like the way you titled this conversation. It is indeed a huge disaster, and it's happening under our watch without us knowing, without it being spoken about. And that's one reason I will give you a kudos for bringing this up. Now, when we talk about female genital mutilation, people think it occurs in rural area, away from where we are, in distant land. But the truth is, it's happening under our watch, uh, because it's something that has to do with female private parts. People will not come out to talk about it in public. But if you have like 10, 15 ladies with you, about and the average 8 to 9 of them will have been mutilated in one form or the other. So it's something that is rampant in our society, but is not being talked about. And the effect this has on the girl child in the long run is one that cannot be overemphasized. It touches the woman from childhood up to adulthood, where the impact is even more felt. In Nigeria, it's the incidents actually, the prevalence actually dropped for some period, but again, in early this year, UNICEF raised alarm that the prevalence is increasing. It used to be around 25%. It dropped to about 18%, but I think the latest figure puts that about 18.9% or thereabout. That is going up again. So this topic is well timed, and we need to let people know about this. And talking about those that should know about this, everybody needs to know about it, be it male or female, be it high class or low class people. Everybody needs to know about it, and we need to keep talking about it. Let people know that this is danger. This is dangerous to their girl child. This is a practice that should be stopped, and we need to keep talking about it over and over until our people stop the practice.
Okay, thank you very much. Dr. Israel. I think Dr. Israel is on ground.
Okay.
Yes.
Happy Sunday to everybody.
Happy Sunday to you too.
Dr. Israel, your network is breaking up. Chief, I wanted to ask you again. Some people really don't know the different types of female genital mutilation. They just believe that it's cutting. You just cut a woman's external genitalia. And we know in medicine that there are various types. Could you help us, sir, break the different types of female genital mutilation for us?
Yeah. The different type of female genital mutilation. Actually, the World Health Organization, after the World Health Organization started taking a more detailed look about this procedure, about this practice, about 2007 thereabout, they classified female genital mutilation into four groups. Now, the first one is partial or total removal of the clitoris. Clitoris is same to the glans penis of the male, which is the part that brings sexual um, um, it makes the clitoris is that organ, that sexual organ in the female that makes sexual interaction more pleasurable. And in this procedure, in the type 1, what the those that do the practice do is to cut it off. um Wicked, as it does, to put it frankly, a wicked act, because that will mean the young lady will not be able to enjoy sexual intercourse all through her life. uh, I do tell people that, just imagine that a male child has his glance cut off. Just imagine how it's going to be all through life. So that is what is being done to young ladies. Sometimes they cut it partially or totally, irrespective of what is done. That's the type 1. Now, the type 2, what they do is they go beyond cutting the clitoris alone. They also cut the labia minora. Now, the female private part has quote and unquote two lips, the inner one and the outer one. So what they do in type 2 is that they cut either of the two lips, either only the inner lips alone, or they cut both of the lips. That's type 2 female genital mutilation. The type 3 is the more horrific one, in which they don't just cut, they also suture the two, they make the two opposed together, meaning that they close up the entrance to the female private part, and that way the only little space that is left is for urination and for menses to pass through. That's the most horrific type. Then the type 4 is any other type of the cuttings that we've described earlier, be it piercing, cutting, any other form of mutilation. So those are the type. In our environment, is the type 1 that is the commonest type that is carried out in this our environment. And they don't see it as anything bad, but like I described to you earlier, that is the similitude of what is done is like cutting off the glans penis of a male. You can all imagine what that would mean to the male child.
Thank you very much, Chief. So the type 1, they cut off the clitoris. They remove the clitoris. That's type 1, which is very common in our environment. The type 2, the removal of the labia. Type 2. Type 3, they now suture the entrance to the vagina. So they reduce the entrance. The opening to the vagina is they close it. They close it. Then type 4 is any other cutting. I know that this has a whole lot of complications. Now, if you have any question, please drop your questions in the box. We'll take your questions very, very soon because I know you have questions to ask us. The complications are so bad. Chief, could you help us? What are the dangers of this act? Why should we be concerned and why should we be bothered?
Okay. Now, let's start from when the procedure is being done to later in life. When the procedure is being done, it's the way it's done at present is that it's done by traditional traditional health attendant and traditional practitioners who use on sterile blade to do this cutting, and they do it in a place that is usually not unhygienic. So from this, the girl child can get infected, including HIV. Girl child can bleed. Sometimes some of these girls are bled to death from this procedure. It's usually done without any form of anesthesia, nothing to relieve pain. So it's a very painful procedure. And remember, I mentioned that the organ for sexual arousal. Now it is very very innervated, and any form of cutting that is done there is usually very very painful. And these girls go through this without any form of analgesia, and in the long run, if with the pain they have from that, they can have urinary retention from this procedure. These are the immediate effects that the female genital mutilation can have on the young girl. But more than that, later in life, it can affect their fertility, their ability to get pregnant can be affected by this. Their receptiveness to sexual intercourse and ultimately having marital disharmony because of this is another complication that can arise from this. The fact that the girl child is aware that she has been mutilated as a young girl is enough to give psychological concern to her. So it sometimes affects them psychologically. The procedure itself can lead to some complications such as clitoridal neuroma, where it causes some form of pain, persistent pain in the young girl because of the procedure that has been carried out in her. Also, from this infection that tetanus can actually come into the girl can get infected with tetanus just from this procedure. Then also another complication that is even very important that we should talk about is that in young girls that have been mutilated, they can have obstetric complications during delivery. For those that get pregnant, it can be a cause of obstetric complications. Sometimes we have to do what we call defibrillation, especially those that have the type 3 type, in which they've closed up the introitus. You need to do some form of surgical procedure before they can deliver successfully. So by and large, a lot of complications come with this procedure with no good associated with it.
A lot of complications arise as a result of the female genital mutilation, as spoken by Dr. Qudus Lawal. Now, he mentioned bleed. If you are just coming, you are welcome. We're talking about female genital mutilation. People that are not medical call it female circumcision. It is not a circumcision, it is mutilation. It's a disaster, a huge disaster. And we have a guest in the house tonight that has been talking to us about this. You're just coming, you are welcome. Now, we were talking about the complication. He mentioned bleeding, he mentioned infections, HIV, he mentioned tetanus, he mentioned psychological trauma. Now, if you have any questions, please, on this particular topic, I want you to begin to drop them down in the comment section. I want to go specifically to the areas of some form of the complications and ask Dr. Lawal. They said that the reason for circumcising in quotes, but they don't know that they are mutilating the woman or the young girl, is that they want to keep her pure. They want to keep her, in quotes again, what's the right word? Chastity. Want to maintain her chastity. Yes. Please, after this whole procedure is done, does it achieve that goal or it worsens it?
Actually, like you rightly say, it's actually worsening the situation. Look at it this way: the girl child, when she grows up to this age when she starts having sexual intercourse, she try having the first sexual intercourse, she doesn't enjoy it. She looks for somebody else again. Maybe this guy is not doing it the right way, and tries to get it again from another person. That way, at the end of the day, rather than maintaining her chastity, rather it even makes her more promiscuous. That's just it. So that's just reality. So cutting of the female genitalia is not a way to maintain chastity. Rather, it actually probably worsen the situation. A gay child should be trained and groomed in a way that she will know what is right from what is wrong, not by cutting off what should give her pleasure later in life.
Thank you very much. Dr. Israel is in the house. Dr. Israel, welcome. Can you hear me now?
Yes, I can hear you. Good evening, everybody. Dr. Lawal, good evening, sir. I'm
Good
very sorry, my
evening.
network, I don't,
Yes,
sometimes it's
I've
me
been
some
coming on
kind
and
of
off.
issue. I don't understand the network.
Yeah.
We have a question, sir. Before we go further to our other question, somebody is asking us, Inyoma is asking, sir, does this effect as well include difficulty during labor that will result to a woman having cesarean section?
Yeah, definitely. It results in difficulty during delivery, especially those that have the type 3 procedures done on them. And effectively, they may usually we do a procedure for them to actually release that closure of the introitus, doing what we call defibrillation. Resulting in cesarean section is not a direct cause of having cesarean section done, but it definitely causes difficulty in delivery.
It will definitely cause difficulty in delivery, but not a direct cause of cesarean section. Okay. Somebody is saying here, even here in Germany, they don't allow it to. Yes, let's talk about the Western world. Is this done in Western world? I don't think so. I think it's more of third world nations. Chief, what do you think, sir?
Yeah, it's let me put it this way. It's not really done in the Western world per se, like a practice that's commonly done in them. but it has been imported over there, and because of that, they are already having legislation to control this. Like the United Kingdom have a legislation for which, even if it's seen in a adult, if as a practitioner you get to see it in an adult, you must report it to the enforcement agency. So it's something is a reportable situation. If you see a woman with female genital mutilation, then you must report it. They will trace back to see where it was done. If it's actually carried out in UK, it may lead to arrest, and they are doing everything to make sure that this act is stopped. And the world has come together to identify it as a practice that should be stopped. So every part in the world, everybody is coming out, looking out for it. If they are aware that it's being carried out in any part of their land, they ensure that that practice is stopped. And Nigeria also has legislation against this. Just recently, the prohibition of I can't remember the name of the act precisely, but there's a act, violence against person, which focus on any form of harmful practices, and this is one of the harmful practices that the legislation is looking to. And some states in Nigeria are actually taking a lead in this. Edo State is one of them that have been active in it. The distribution in Nigeria is actually varies depending on the geopolitical zone. It's commonest in the southeast of Nigeria. Again, it's a practice that has been done over the years over there, so it's going down, but there is still more that needs to be done in that area.
Thank you very much, Dr. Lawal, for this insightful information. I almost wanted to ask about what Nigeria is doing concerning this practice before you told us about the legislative aspect of it. So our audience will encourage you guys to ask a question on it. Female genital mutilation, what most people normally call female circumcision. However, let you know that there's nothing like female circumcision. It's known as female genital mutilation. Now somebody is asking, type 3. So the female genital mutilation is in 3 stages. Too bad. Okay. I think this person will want to know the different types again because he actually came late.
Yeah, okay. Let me take it again. The female genital mutilation has been categorized into 4 groups for purpose of description and for purpose of understanding the extent of the damage that has been done to the girl child. The commonest one that is carried out in our environment is what we call the type 1, which is any cutting of the clitoris or its prepuce, be it total or partial. That's the type 1. In the type 2, the labia, like I said earlier, is like the lips of the introitus of the private part, which the female person has to. The inner one we call the labia minora, and the outer one which we call the labia majora. Now, any cutting of this, in addition to cutting of the clitoris, is the type 2. Now, the type 3 is one in which it's not just about cutting, they go beyond cutting it. They now oppose the two edges together, invariably closing up the entrance to the female genital tract. And that's the type 3. The type 4 is any other form of mutilation that is carried out in the private part, be it piercing, cutting, insertion of caustic substance into the private part. Those are the type 4. In Nigeria, it's a practice that cuts across all geopolitical zones, like I mentioned, but it's commoner in southeast and southwest Nigeria, in particular Ebonyi State, Imo State, Ekiti State, Osun State, and Oyo State. Those are the 5 leading states when you talk about female genital mutilation.
Thank you very much. I had irregular contraction twice, which result in me having all my five kids through cesarean section. Just wondering if it has a result of that. If it's as a result of the female genital mutilation. I think this person was had the female circumcision or female genital mutilation. So he wanted to know if that's the cause of his five cesarean section.
I do not think so. Irregular contraction or ineffective contraction, so to say, or dysfunctional labor will not result from a mutilation. Of course, it can affect labor, like I mentioned earlier, but usually it's in the second stage of labor where you have that challenge with mutilation, not dysfunctional labor. So it's not necessarily due to the mutilation.
Okay. Someone is saying in UK it's 10 years imprisonment. Um, okay. Do we have more questions? Let's see. Let's see. Okay. We don't have.
Like I made reference to, the United Kingdom have taken the lead in terms of controlling female genital mutilation, and they have legislation that is clearly stated. Not just if it's carried out, it's not just the what's it called, the practitioners that need to answer questions. Even the parents will have to answer question about the mutilation,
Hmm. Someone is
and
saying
it
when
has.
I had. Okay. Go ahead, sir.
Oh, yeah. It has, because of this cultural thing about it, it's a cultural thing, and people have imbibed this into themselves. So what some people do, some people based in UK, what they do is that they travel down to Somalia, because one of the places where mutilation is so common is in Somalia, Sudan, Eritrea, and all those parts of Africa. So what they sometimes do is that they travel out of UK, for those of them that have been in UK, to go get it done and now come back. If this is done and it's found out, the UK authority, the agencies usually take it up on such person, and is enough reason to deport um, such citizens, such immigrants. So they are stand on the ruling on mutilation.
Okay. As
Okay.
guys, yes.
Hello.
It says yes. It says when I had my baby girl, my mom insisted on doing it. I no grill. My dad, being a guy man, refused. Um. Okay. Someone is saying in Ireland, a family carried out the act and the child died. The parents were jailed, I think, for life.
Yeah.
Yes, Chief. How else should we sensitize our people? Because I know we have been talking almost every year, we have been talking. How else should we pass this information across? I think the people that really need this information, some of them might not be privileged to be online listening to us. How else do we drive the conversation to them?
All right. Thank you very much. There are a lot of factors involved in female genital mutilation. And if we refuse to address those factors that are pushing this trend, then in the long run, we won't achieve what we intend to achieve. Now, there is economic factor. Maybe surprised that I mentioned economic factor, but there is economic factor to it. The practitioners that do this have been doing it over the years, and this is their means of livelihood. So when you are pushing against them that female genital mutilation should be stopped, this, that, and that, you are essentially saying that you're taking away their source of income from them. But what we can do, and what has been done in some places, is that you give them alternative work to do. You don't just say they should stop, you get them something else to do. For example, if you have a woman that practices female genital mutilation, You can ask her to stop and let her work in a PHC as a means of getting people to get to go to seek healthcare, like a community health extension worker kind of, where you help them. They change from the illicit act they are doing to what will benefit the society. So that is one. Two, it is a cultural thing, and the best way to address the cultural problem is to go to the head of the community and make them convinced that this is a practice that needs to change. They will be in the best position to pass the message to their people, because if you just enter a community and just talk to them and leave, there is nobody there to maintain the message. So if you go through the community head to pass the message to their people, they will one they will be willing to listen to them. Two, they'll be there to maintain, to keep passing the message across. They know their own people. They know those that practice this act. They will be able to identify them and tell them they need to change their ways. So that's involving the community elders. Then three, we as the government need to be dedicated to this. They need to take it up, just like some state governments are already doing. Government taking this up means that they will dedicate people that will look into this, who will strategically be placed to look at where this procedure is being done. So if, for example, a gynecologist come across a young girl that has a mutilation, they will be able to refer to this group, this organization, so to say, who will now trade back on where it was carried out and identify where it is being done and able to stop the practice. But just the public awareness, which is actually not getting to the rural community, may not really have the impact we want to have. Definitely, this will have its impact, because some people on this call today will get this message and go back to their villages and town and pass the message across to them. So it will definitely have some impact. But we need to go to the interland when it is being carried out. Of course, it is not being carried out in the hospital, so um, focusing on healthcare practitioners may not necessarily be the main thing, but we need to go to those villages where we have the uh, practitioners staying in. Talking about hospital, that reminds me of a point that needs to be made.
Okay, sir.
Because of what we referred to when I was making my introduction, talking about the people that do it, the
Yes.
the the fact that they do it in unhygienic place, they do it without anesthesia and all of that. Some people are now trying to medicalize the practice,
Okay.
especially from the area where the culture of FGM is common. So they now try to do it in a medicalized way, in quotes, meaning that they do the cutting in a hygienic place, in a place that's hygienic, in a place where they can give some form of anesthesia. Again, the
In a
overall.
bit to justify their actions.
Exactly. But in the long run, you realize that it's not just the immediate effect that is there. The long-term effect that it has on the girl child is there. It affects her fertility, it affects her psychosocial well-being, and at the end of the day, the girl child will be deprived of her sexual arousal organ. Like I mentioned earlier, the similitude of what is done to the girl child is cutting off the glands of a male. I know what that means. So whether you do it in a medicalized way or not, it doesn't uh, take away the fact that it's a horrific act, it's a wicked act, and it's an act that needs to be stopped.
Okay, somebody is just coming and the person is justifying why it should be done. So I think this person missed the discussion. Somebody's asking us, can the female genital mutilation be the cause of pain during and after sexual intercourse?
Definitely, it can be a cause of pain during and after sexual intercourse, because when the procedure is done, it's oftentimes associated with scarring, in which the genital tract is scarred and probably reducing the elasticity of the genital tract. So it can come with pain. I mentioned something earlier about clitoridal neuroma, where the person persistently have pain almost all through our life because of the cutting that has been done. This can also cause what we call dyspareunia, that's the pain during sexual intercourse. So it can cause pain.
Rachel Idowu says, I agree that it's not good nowadays, but I think it have its advantage. Before we continue with the other part of this comment, sir, does female genital mutilation have any advantage?
Now, does female genital mutilation have any advantage? I'm just looking at the right words to actually pick to explain this.
Yes.
It has no advantage. Let me just put it that way, in clear terms. Because any advantage that you think can accrue from doing the mutilation can actually be achieved without doing mutilation. It's about chastity. You can make your girl remain a virgin and be a good girl without necessarily having to cut the female genitalia in any form. So it uh, doesn't give any form of positive, so to say.
The other part of the comment says, nowadays, a 12 years of age, if a young boy touches her, her body will be on, which does not happen in the 50s and 60s. Chief, could you please help address this? I think this is a misconception.
Yeah, the girl child being arose from being touched is not because her genitalia has been cut or not been cut. It has no relationship to the presence or absence of a clitoris. It's not related to the presence of a mutilation. Whether mutilated or not, a girl child can be aroused from anything. So what we should focus on is not mutilating the girl child to prevent the girl from being promiscuous. Rather, we should focus on training the girl child in the appropriate way. So the arousal from touching and all of that is not because the genitalia has not been mutilated.
Okay. So, Madam Rachel, you understand, right? It's not because they circumcise her. That is why she's acting like this. I think it's also part of the hormones because I think some 12 years old are already in puberty. So
Definitely.
they have the reproductive hormones, so she would respond. Okay.
Definitely.
Somebody is saying also after all the efforts to put to stop it, if they refuse, they should be arrested. The government should put this in place. Chief, has there been any arrest in Nigeria with regarding this?
Usually what I've known is that it's persuasion and then making them to stop the act, but outright arrest based on female genital mutilation in the country, I've not actually come across one. Like I said, the law is there, but it has not been domesticated in most parts of the country. And again, this is a call on the government of different states to domesticate this law and put it into action so that this practice can stop.
Okay, thank you, sir. Dr. Blessing is online. Dr. Blessing, how are you doing?
Yeah, I'm fine. Oh, Chifu.
Ah, now, good evening. Blessing, how
I'm
are you?
fine. I'm very
Nice.
well, very well. It's been a long
Nice.
while, Chief. I'm happy to see you once
Yeah,
again.
you guys are doing great.
Thank you, boss. Thank you, boss. So sorry, it's an interesting topic, and I've not been able to meet up, because of some busy schedules. I just keep up on it.
That's the life of a
So, but
doctor.
yeah, but then female genital mutilation, right? I just wanted. I probably have missed. Maybe you may have discussed much of so much about it, and I may have missed some part. But I just wanted to ask about one misconception. If I don't know
Okay.
if it has been addressed or not addressed, because it's common. and people carry it around and they think that um, if it has been addressed, it's okay. Some people say that mutilating the genital region or the genitals of a female will prevent them from becoming promiscuous. So, is there a relationship medically to that, or is there anything? Is it true?
Yeah, we've actually addressed that, but for emphasis, let me just still reiterate what we said earlier. I said it has been shown that, on the contrary, the the thinking is that to reduce female promiscuity, but on the contrary, it may even promote promiscuity, because the girl child does not enjoy sexual intercourse from the first contact she had. She will try and get another person and see whether she actually enjoy the intercourse. At the end of the day, they keep moving from one man to the other in search of enjoyable sex, which they will never have. So in essence, it makes them more promiscuous.
Okay, so I want to ask a somewhat reverse question. Does people who have been circumcised or who have been mutilated, females who have been mutilated, do they still enjoy sex?
Unfortunately, the part of their genitalia that should make them enjoy sex has been cut off. So sex, for most of them, is not enjoyable. And unfortunately, clitoris is not something that you can reimplant. You cannot, once it has been cut off, there is no medical procedure to bring back or to refashion a clitoris. So for life, those people have been sentenced to a life of unpleasurable sex. Anyway,
Yeah,
it also depends on the extent of what has been done. But in general, that's the reality.
I agree. So,
So, if I may add to this, what is now the effect on marriage? Let's say a woman is married, uh, she had her genitalia mutilated. What is the effect with regards to this woman and her partner and on marriage?
Yes, that's something I've made reference to earlier. It results in marital disharmony, and what happens usually, because sex is not a pleasurable act for the lady is not so willing to have sex with her partner, and what that would mean is that once the partner comes in that he wants to have intercourse, the woman will say no, she's not willing to have it. They only do it as part of, they feel like it's like their um it's like their duty to do, not like because they enjoy it. So they don't uh, they don't have sexual intercourse often with their partner. We all know the role of regular intercourse with partner in uh, in marriage and relationship. So because of this, they tend to have marital disharmony, and it can actually lead to a breakup of relationship.
Hmm. Can lead to breakup of relationships. Interesting. If you have any question, please do well to drop your questions or your comments on. Okay, let's see. We have a comment here. Alex Ogoa says awareness should be taught to the girl child at school. Does this awareness relate to the girl child or the guardian? I think this information should be at the doorstep of the guardian, the parents, and not the girl child, because the girl child is a victim of the ignorance of her guardians, of her parents, and the community at large. What do you think, sir?
Yeah, I agree with you. I think the message, the awareness should be taken to the parent and guardians, because they are the one that actually inflicts this pain on the girl child. The girl child is vulnerable. She has little or no say in it. Even if she's aware that it's a bad act, she may not have control over what is done on her. In most part of the world, usually done at early age, before the age of 5. But in some parts, it can be delayed till about age 15. So we have girls of about 12, 13, 14, 15 having this procedure done on them. So awareness in those girls about 13, 15 who have some little form of liberty to them may actually also be important. But overall, the people that need to be talked to is are the parents and guardians.
Okay.
So,
So
Mr.
Chief,
Alex, I
I
believe
don't
you've
know,
got the information. Yes.
Chief. So how common we know the have there been any improvement in this regard in terms of um you know reducing the incidence of female genital mutilation? I know it's common, much more common. Then I'm talking about children who are being born. What is the prevalence of female genital mutilation among female births as at today?
Okay. Yes, I made a reference to this earlier that the prevalence, I'm talking about Nigeria now. The prevalence rate as at early 2013 thereabout is about 25%. It dropped to about 16.9% later on, but unfortunately, this figure is on the rise again, and it's put at 19.2% in recent time. So we still have our job cut out for us. We need to go out and keep improving the awareness about this, how harmful the practice is. Um, we need to the chain in incidents also relates to the effort that was carried out at some point in time where it was on the front burner, but unfortunately is not is no longer on the front burner like it used to be in those early about 2013, 2015, and thereabout. We are talking less about it, maybe because we felt that the practice is being dropped, but the reality is that the procedure, the practice is still on, and we need to actively engage the population about this procedure and tell them that they need to stop carrying out this practice.
Okay, so is there any apart from the sex related effects and all that, complications that may arise from it, maybe as a result of adhesion of vaginal adhesion or anything of sort? Is there any other medical related or even I don't know, even obstetrics complication uh, related to female genital mutilation?
Yeah, there are complications that can arise from mutilation beyond the sexual related one. It can lead to stricture, urethral stricture, because the area that is called is close to the urethra. Urethra is where the urine passes through. So if they inadvertently involve the urethra, it can lead to difficulty in passing urine and all of that. It can also lead to, excuse me, it can also lead to infection, like I mentioned earlier. Then scarring of the genitalia, which will cause some form of gynetrasia, that is reducing the outlet, the introitus, the vaginal capacity. This will lead to dyspareunia later in life and all of that. Then it can also cause the psychological effect on the girl child. It can lead to anxiety, depression, and all of that. So the effect of the mutilation is not just about sex. It has a overarching effect on the total uh, girl child, not just on her sexual well-being.
Wow. Okay. That means actually there is actually no single advantage of female genital mutilation.
Not
It's
at all.
not at all. Okay. Okay. Public health advocacy and all that needs to be. I don't know. Yeah, is there any program from the I don't know, from the federal government, the state government, or even the local um, health centers? Are there regular programs targeted against? I mean, awareness against female genital mutilation, or how do we come in as individual doctors and as a unit, as a hospital, as a public health?
Yes. The first thing is that there is what we call International Day of Zero Tolerance for FGM, which is commemorated worldwide, and these are type of program to discourage people from practicing this procedure. It's used to raise awareness about female genital mutilation, usually carried out in February every year. That's a
Mm.
form of awareness creation. It has also been noticed that a woman that is circumcised, so in quotes, a woman that has a female genital mutilation is likely to carry it out on her girl child, especially in areas where the culture is profound. So as such, if one come across any woman that have FGM, it's important to educate that woman that it is a practice that needs to be stopped. So that's another important thing that should be done. Then, as health practitioners, when we come across at delivery, when we take delivery of the girl child and all of that, this should be component of what we talk to when we are doing our talk to the women. These at delivery, these are things we need to also add to their enlightenment. Tell them about how dangerous the procedure is and why they should not carry it out for their girl child. Because at that time we have opportunity of stopping it, not when it has been done already. So if at delivery, it made them know the dangers of carrying this out during the following delivery. Is it will go a long way in reducing this act.
Thank you very much, sir. We are rounding up the next few minutes. We're almost out of time. One more question. I know you spoke about it, but if you could help us, sir, what is the mental health challenges that most of these ladies go through that some of us are not really taking into cognizance? I know we talk about the obstetric complications, the infections, and the rest, but the mental health part, because we know in this part of the world, we are not really keen in talking about mental health. But let's just briefly go into that area. What are those challenges that they face mentally?
Yeah, the procedure comes with anxiety. It comes with depression. Then sometimes there are post-traumatic stress disorder, especially for those that it was carried out where they are already in the ages of 12, 13, and 15. Because when this thing is carried out, it's carried out without anesthesia, like I mentioned earlier. It's carried out usually as a right for the girl child in pains, bleeding, and all of that. So they may encounter post-traumatic stress disorder. Then sometimes that somatization occurs because of this procedure. They start because of the psychological effect. They start describing some vague symptoms which are not necessarily there, and this may be because of that procedure that has been carried out in them. For example, you see them coming down that there is something in their private part, there is this there, there's something there that is not living, something's working on their body, all of that. This might be associated with the mutilation that has been done to them.
Mm. Does this have any direct effect on the males, or is it just specifically for the females? Do the men have any related complications from this thing being carried out on the women? I don't know if there's a link, but let's just, I don't know. What do you think, sir?
Yeah,
Maybe you are talking about when they get married or the people that are in direct relationship with, right?
Yeah, yeah,
Yeah,
yeah.
if it may have some psychological effect on them
yeah.
too.
Effect on
Yes,
the men.
maybe.
In what area? Yes.
Yes. Just let's play back to the scenario I discussed earlier when I was talking about marital disharmony. When your wife is not willing to have sexual intercourse with you, you start having psychological concern. Is it that she's cheating somewhere? That's why she's not coming close to him. All sort of anxiety and issues starts passing through the mind of the man too. So it doesn't just affect the lady; it also affect the partner during during marriage. So it has effect in the man in the long run. Then sometimes those that have had some form of scarring in the genital tract, sex may not be pleasurable for the man too. So in the long run, it doesn't just affect the young lady; it also affects her partner.
Wow. So after hearing this, I know I came late. You may have, I may have even been asking some questions that were asked before, but it's obviously a very insightful section. The little I've had is enough for me to go to war against this female genital mutilation on my own uh, on my own path. As a medical doctor. So yeah, so this topic should be discussed every time as an awareness, to keep us. I mean, to me, as far as I'm concerned, I don't know if Dr. Fred and Dr. Oz, if you could still do this with Dr. Lawal, maybe, you know, from another angle, looking at it from another perspective, sometime later, because I think it's a very important topic. I thought the prevalence must have even decreased for me to be saying that. For Dr. Lau mentioned 19 point something, that's still much. That's still very much, and it's from what we have learned so far, it has no single benefit. So it all have some, it's something that should really be. I don't see why we should be inflicting some kind of harm to ourselves in the name of cultural or whatever it is. So it's to me, I consider it as a war, and I would try. I think I should up my game on that regard. Thank you very much, sir, for
Thank
this.
you. Thank you very much for having me.
Yeah, thank you so much. Chief, do you have
Uh,
any final
I'm very
words
sorry
as we
that
round
my
up? Dr. Israel?
I'm very sorry that my network has
Yes,
okay.
yeah,
I'm very sorry
sometimes.
that my network has been so funny. What I want to even say is as we fight against this mutilation, most people still think it's circumcision. As keep on trying to remove that from their mind, because mutilation is something like, when you say mutilation, it means that you are spoiling something, you are killing something. I think the nurses, midwife has a lot of role to play in educating mothers, because when Dr. Lawal was speaking some things, he said these young girls are vulnerable because they are still, some of them are still babies when these things are done on them. So they don't even know that some of them don't even know that something like that actually was done on them. So I think during when these pregnant women come for antenatal, during their antenatal visits, I think it will be a good thing if midwives and nurses try to educate them, tell them the disadvantage of female genital mutilation. Because most of this, you'll be surprised. I was surprised to know that young ladies still believe that they must do female genital mutilation in this 21st century. I was surprised. Young ladies, not like, if it's an old woman that was talking to me, if it was an old woman, I would say, okay, it's because this one is old. It's what, but for someone at the age of 23, 24, saying that she must do female genital mutilation for her daughter is funny. So I think our nurses also have a lot of role to play in educating these women as they come for antenatal, so that they can also have it in their mind and disabuse it, even when their their mothers or their mother-in-law is trying to insist on such practice. Dr. Lawal, thank you so much for today. Thank you
Yeah,
for being
thank you
with
very
us. We really appreciate your coming, even with the short notice. Thank you so much. So, any final
much.
word for us before we call it a day?
Yeah, it's the practice is one that should be discouraged. It's horrific. It's wickedness on the girl child, and as such, we should all go out to educate the populace about the dangers of carrying out this procedure and the fact that it does not confer any benefits. This is the message we should take out, that there is no benefit that comes from doing this, and it's it harms the girl child for our lifetime. So we should pass this message to as many people as possible until we eradicate or eliminate this practice in our society. Thank you.
Thank you very much, sir. We are grateful that you make out time to join us tonight. I understand that you were a little bit under the weather, but you came here to add your voice to this barbaric act that our people still carry out on innocent girls. We are sincerely grateful. I want to appeal to those listening to us. Please help us share this video on your Facebook. Just share. More people needs to see. Those on your wall, those on your page, those people that are following you needs to see this information. So please help us share the video so that they can see, they can watch and get informed. That is the only way you encourage us. Thank you once again, sir.
Thank you
Thank
very
you
much.
very much. Thank you very much, sir.
Thank you. Thank you.
Thank you.
We are grateful, sir. Um, So, guys, we'll be ending this program. It's every Sunday by 8 p.m. I have my co hosts, they are here with me today. We are very much complete. Dr. Blessing is here, Dr. Israel is here, and sometimes we are not complete. Sometimes some people are very busy because of work or the other. But right now, we have everybody on ground. So, we want to appeal to you, do well to share this video, share the flyers. We are doing this for you for free. There's no advert yet. When adverts come, we'll put adverts. But right now, we are making our time, making our data, giving you access to ask questions, speak with doctors, professionals on this platform. The best you can do for us is to please help us share this video and invite your friends to come listen. And then follow the doctors you see on this page. So you can also follow them on their social media handles. Thank you very much. Any final words, Dr. Israel, Dr. Blessing, as we round up?
Can you hear me?
Yeah, I can hear you now.
So I really don't have much to say though. It has all been said, very perfectly, and it's been a very insightful one. So, the last one more thing as a way of emphasis is just to lend my voice on the need for us all to do more. I like what Dr. Israel said, the fact that it should be, taken to the antenatal clinics. That's one part. I think it should even be inculcated. Dr. Lawal just left. Maybe if we could just tell him if there's a way they could inculcate it into the practice of one of the routine, activities that should be carried out during antenatal clinic. I think it should go a long way, in helping. It's not just those who attend, but those who attend at antenatal clinic could still pass the experience to those who are not able to attend, and by so doing, spreading the message in a very, easy and very convenient way. So please let us all take notes. Female genital mutilation is barbaric, is inhumane, just like the Lawal said, wickedness against our own children. So we should try as much as possible to stop it and stop everybody who does it. It has a ripple effect, not just on the person, but and on people who are associated with the female child when it comes to marriage or like. So just like we've had today. So thank you all very much.
Thank you, everybody. Thank you, Dr. Blessing. Thank you, thank you, thank you. Like I'll always say, good life now waiting. Good life now sense. This program every Sunday, 8 p.m. West African time. We do our best not to start late. When it's 8 on the dots, you will always find us here. Take care of yourself and have a wonderful evening. I'm going to upload this video on Facebook and it will also be on YouTube so that people can see this video and watch later on in the future. Have a wonderful evening. Good night. Bye bye. Bye bye. Bye bye. Yeah, we're shutting down. I'm giving like 30 seconds for everybody to say bye bye and then we end. Bye. Bye. Kudos. Yes, thank you very much. Bye. Share the live. Share the live. Share the live. Yes. Bye, guys. Bye. Thank you. God bless every one of you. Bye bye.